Hi, I'm nurse theorist Florence Nightingale, and I want to talk about one of my most important theories. I was considered a pioneer within the field of nursing and am responsible for creating an environmental theory, basically manipulation of the environment to care for the sick. I thought that a cleaner, better environment would increase patient outcomes. I believed there were five essential elements to securing a healthy environment, or as I called it, a healthy house. These elements include pure air, pure water, light, cleanliness, and efficient drainage. I was born in 1820 to a fairly wealthy family and received a good education. By the time I was 25 years old, I decided to pursue a nursing career, and even though it was considered a job more for common folk and more menial for my type of upbringing, I definitely wanted to pursue it. I trained in Egypt and Germany, and I ended up as the superintendent of the hospital in London. A little bit about me, my nursing career. In 1853, I volunteered my services and was given a team of 38 nurses to help wounded soldiers in the Crimean War, many of whom were injured in the war but were dying and even more gravely ill due to diseases they got while under care of doctors and nurses. During this time, I realized the need for a cleaner environment for those wounded, and I noticed their deaths again coming from contagious disease more than battle wounds. I began teaching. I used my experience from the battlefield, and I began teaching sanitary reform in the hospital setting. In 1860, I opened the Nightingale Training School and Home for Nurses in London. I went on to publish 200 pamphlets and books to help with this education. My theory is considered a grand theory because of its broad nature. It is not really empirically testable because it is so broad, and it transcends nursing into everyday life. So it can help improve the health of not only the patients we were taking care of, but also individuals outside the hospital. This theory, again, can be described as a grand theory because it represents such a broad nature and its purpose and goals and discipline. Key concepts to the theory. Again, we talked about the elements to a clean house. There are a few examples. And one of the three elements to that are the theory that the environment has to the patient, the nurse has to the environment, and the nurse has to the patient. So those three elements are huge within my theory. The need for light, particularly sunlight, is second only to the need for ventilation. If necessary, the nurse should move the patient about after sun according to the aspects of the room. So, try to keep them within the natural light. Nursing's role is to manipulate the environment and encourage healing. Nursing ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection of administration of diet. A good nurse is never to allow a patient to be awakened intentionally or accidentally, and variety is important for patients to, divert them from dwelling on their pain. My theory associated to nursing in regard to the person. This theory is pertinent to all individuals, again, not just those in the hospital. Health is described as a state of well-being, and using, one's powers to the fullness. Illness or disease is the reaction of nature against the conditions which human beings have placed themselves. The nurse themselves, nursing is a service to humanity intended to relieve pain and suffering. And nursing's role is to promote or provide the proper environment for the patients, again, including the fresh air, pure water, cleanliness, etc. Again, the environment, this is the cornerstone of this whole theory. Clean environment, will increase patient outcomes. Within the recent articles related to this theory, The study's goal was to evaluate 3 separate methods' effect on hospital cleanliness and then identify the risk to patients from a contaminated environment. The outcomes from this study were very specific. Routine cleaning appears to have some effect on adenosine triphosphate values, which were what the researchers had measured to identify dirty surfaces. Again, further indication of proof for this theory and how effective cleaning techniques will continue to improve patient outcomes. A scenario where this theory is applied in practice, since this, theory is over 100 years old, from then till now, there's been a ton of research to expand upon it. Cleanliness and sterilization are widely accepted as huge components to safe patient care, and you'll see this anywhere within any hospital setting or private clinical setting. In my own experience, being in a OR, we, just being able to see the areas that are specifically designated as sterile field and knowing that you can't enter those areas, again, just proves further that, a clean, surgical suite is important to positive outcomes. In just conclusion, that I believe that this theory is the foundation of advancement for increased patient care and patient environments. It's not, again, only pertinent to those in the hospital, but also those who, every day, a clean environment will definitely keep people healthier. So, a few references here at the end, and thanks so much.